right, everybody, we're back. My next guest has hosted the sex advice show Loveline for almost 25 years. His new show, Celebrity Rehab Presents Sober House, premieres this Thursday night at 10 on VH1. Please welcome Dr. Drew Pinsky.
Okay.
But thank you so much for being here.
My pleasure.
And
Thanks for having me.
a lot to talk about. And that was nice. You did bring me a book. Not a lot of guests bring a gift. A very interesting book on Lincoln that I'd never seen.
I know you're a Lincolnophile, and I'm not quite at the level you're at, but I'll enjoy that stuff too. So, and I know our president-elect is very much interested in Lincoln's thinking.
President-elect Obama constantly reading books about Lincoln, and you know. But let's talk about you.
Okay.
Then about me, and then about Lincoln.
Okay. Perfect.
There are people, and I'm a big fan of yours, and I think you take a very serious and sort of realistic approach to what you do on television. There are some people that work in television that you've been a little critical of, namely Dr. Phil.
Oh my God, we're going here again.
Yeah,
okay.
well, I think it's. Well, last time you were on the show, you talked a little bit about Dr. Phil and how you brought up that he really isn't a doctor.
He's not a physician. He's not an MD. I'm an MD, physician, and he doesn't have a license, which is interesting. That people that don't have a license you can go on TV and do anything you want. There's no sort of standard you're held to.
I don't have a license either, actually.
See how it works? I mean, that's what I'm saying.
I just get out here and go, hiya, folks.
I mean, he does great television, but it disturbs me sometimes that there's no standards of care in what goes on TV, and people don't know what they're looking at. They can't evaluate what they're saying.
Well, first of all, your approach is very different from his. You believe in. You're really trying to be very compassionate towards the person and try to listen to them.
Yes.
Dr. Phil's shtick or method is to shtick being the medical term. Is to really go after them.
Yes. You're lower than a junk house dog.
The easiest thing. I wish all I do to my patients go, you need to stop doing that heroin. Don't you see what's happening here?
Right.
I mean, that'd
slap them around.
That'd be so easy. I mean, of course they know what's going on. They can't stop. That's the problem. There's a part of their brain not functioning normally in that state, and we know about that. And so to yell at them about it accomplishes absolutely nothing, except it makes them feel more shame, more guilt, more awful about themselves, and more likely to use drugs.
Well, one of the things when I watch you work, there's so many situations when I would watch an episode of Celebrity Rehab or something where I would say I would not be as patient as Dr. Drew. I would not be able to be that patient with this person. This person, I just got called to the rehab center
because
at 3 in the...
Jeff Conway's calling the police again?
Yes, and you have to show up, and it's like the 15th time that you've had to deal with him. Yeah. Do you ever find yourself just wanting to scream at them?
I mean, maybe a little bit. I mean, you get angry and frustrated, but the difference is when you really know the pain and the emptiness that they're trying to contend with, and when you're sort of communing with that a little bit. By the way, the first time I heard the word consumption on late night television was about 10 minutes ago.
That didn't mean food.
There are eating competitions.
Well done.
Yeah.
Consumption. I haven't heard that since reading a Thomas Hardy book.
Yeah.
But when you're communing with that deep pain that they're in, it's very hard to get angry and frustrated with them because you actually feel I feel what they're experiencing. And it's so profound and it's so painful, and I understand that's what's driving a lot of this. So I sort of come from that place. And yet, though, even so, I'm trying to hold them accountable for their behaviors. I mean, the one thing, I'll tell you what, here's a secret. The one thing that's different about Celebrity Rehab that is different than what I do in my day in, day out profession is that in the real world, when we're treating drug addicts, if they misbehave, we kick them out. In Celebrity Rehab, we sort of agree they'll stay. We kind of say, all right, we'll let them get them through 3 weeks, we'll pull them through. And by keeping them in, the outcomes actually are pretty damn good. One thing we know about Celebrity Rehab, if people are paid to be there and are going to be on TV, they're likely to stay. They won't leave on their own either.
Right.
And so they stay, they hang with it, we do good treatment with them. And somebody like Gary Busey, who starts out in a lot of denial and confusion about what...
Well, he came on the show sort of saying, I'm here to counsel and talk to other people about their problem, which I think is classic. People with a problem saying, I'm here to straighten out everybody else, and refusing to believe that they have a problem.
Right. And Amber Smith, towards the end of treatment, said something very funny. She goes, I'm going to go to sober living where there are people that aren't as sick as me there talking to us.
Right.
But the fact is that he had a great transformation in treatment, and by hanging in with him, he really did quite well. Now, this next program, the Sober House show, is really about the next stage of treatment, when they start transitioning out into the world, and I treat them as an outpatient. and antics ensue, as you might imagine.
Because the failure rate must be pretty high.
It's pretty high.
For people that say that they've kicked their drug of choice, I don't know what it is, but is it 80%?
It's like 80, 90% when they're in treatment, obviously, when they're in an intensive environment. When they leave, it drops down to about 10 or 20%. Right. And now that's for those that don't do sober living. If you do sober living, which is a structured living environment where people are very quiet audience today.
Well, we're not. These aren't funny things we're talking about.
I know.
I don't understand why this thing about the horrible deep pain people are feeling isn't killing with the crowd. Dr. Drew.
Well, they seem interested anyway.
Yeah.
They seem to be with
Dr. Drew's like, I don't get it. This kills in Vegas. Jim Conaway was in horrible pain.
I also have to say that it's the greatest sentence I've ever heard is I treated him as an outpatient and antics ensue. I've never heard antics ensue after that.
Yes. It sounds like a kooky movie.
Because stuff happens. I mean, when people get out of the structured environment of an inpatient or residential setting, they relapse, they get into crazy behaviors, and we do the best to sort of help them contain that and develop a sober life. But a lot of people, that's where they fall down. And a lot of people don't even get that sober living piece. They try to go directly back into their life.
Right.
That's usually
that can't happen.
That's what happens all the time, but it's ridiculous.
Let's talk about other reality TV shows because
you like bashing everybody else.
No, please. That's not what I do. I'm a kind man. I watch a lot of reality TV, and I'm not saying anything that I don't honestly believe is true. I think a lot of reality television these days, and you can see it all over the place, is they go out and they find people with personality disorders, borderline personality disorders, and they put them in a situation, and they give them lots of alcohol, and then they film it. I really believe that is.
And they put them on a bus.
You're talking, of course, about Rock of Love with Bret Michaels.
Mm-hmm. That was awesome.
Yeah. Well,
guys like this, watch it.
Every time there he is. He's just thrilled to be mentioned. Who mentioned me? But I do, and I'm not just picking on that show.
It's borderline narcissist, histrionic,
There's a show called The Bad
alcohol.
Girls Club or something. I just flip around and see these things occasionally. And again, they got like 3 girls who all have insane personality disorders and give them a lot of alcohol. And they're like, you better respect me because and then put it on the air. And is that not just what we're doing now?
That is what we're doing now. And unfortunately, a lot of reality shows...
I like it.
A lot of reality shows, they even then distort and mess around with things even more. I mean, in the shows I'm doing, thank God, the producers, nobody's allowed to do anything. I mean, I always tell them, it's like, look, these are people who are sick. They're not patients. Things happen in treatment. Just let them, treat them like patients. Plenty will happen, believe me. But in many reality shows, they're monkeyed with and screwed with. And these are sick.
And I don't mean to bash Bret Michaels, because in fairness, he is a doctor. He is.
I mean, he's not of a license, but
No, Cornell. He's he's an endocrinologist.
But the girls,
done a lot of important work.
Studied a lot of glands, it appears. But
now you're on your good material. Now, Dr. Drew's
But I've been around these reality shows where they do psychological screening. The screenings are basically, are you going to kill yourself, kill somebody else, and are they going to be able to not have a thought disorder during the time they're there?
Right.
Not much else.
Right.
I mean, it's just, are you sort of quasi-stable and not hurting yourself or someone else while you're in a program? It's tough. And they screen for the sicker types because they make more drama. I mean, look, what is drama anyway? I mean, even scripted drama is about sick people.
Yeah, certainly mine is.
Right.
No, but and it's also
Thank you, 2 people who saw episode.
Yeah.
By the way,
I really believe it all started. You know where I think it started? And I'm a historian of these things. I believe that it started on Puck in the real world, like back in 1995. Remember, he got all the attention because he was someone with a crazy personality disorder who was always walking to the house like, deal with it, dude, and throwing his messenger bike across the room. And it went through the roof, and all the producers in the reality world said, that's what we need. Let's go find people with crazy brain disorders.
I've always said that it is, what we've done is what P.T. Barnum did with physical disorders, and now we're doing it with emotional disorders. Same thing. We point and laugh and make fun of and tell them they ought to just be able to change. No, these are real disorders. They require real treatment, real human empathy, and with trust and with attunement, which kind of stuff I'm trying to create in TV, the TV shows that show reality rather than reality shows, these people do get better. Yeah. And so there is hope and redemption out there. So.
Well, I never make fun of anyone. And I'll continue to do that. Celebrity Rehab presents Sober House, premieres Thursday night at 10 on VH1. Best of luck with that, and thanks for stopping by. Dr. Pinsky, everybody, we'll be right back. Eric Hutchins. Atkinson going to perform?